initials RL. 2019 saline implants below the muscle. This is what the patient told me. And so I removed a lot of this tissue on the side to help with the contouring. I'm very happy with how the whole dissection has gone. Inflamed tissue, there was a lot of inflammation that was present, and I'm overall very happy how the whole dissection has gone. So in my practice, as you will see, it's not only the implant, but also the inflamed, the capsule tissue, the capsule tissue that's there, and also that inflamed tissue around that needs to go. So let's go ahead and cut over here to see what this tissue is about. And as you will see, it's scar tissue, right? This is that capsular tissue, and it's not healthy tissue. As I touched it, it's nodular, it's irregular, and as I cut this open, relatively very small implants. And again, as you will see, as I go in, you can see how thin the capsule is. If I take the ruler, you can see how transparent thin this is. And guess what? This is not your saline implant. It is actually your silicone implant. And I could tell by touching, examining her. And this is that small amount of, you can see, look at the gum sign, if you will, that leaching of the silicone. And this is your Allergan 220 silicone implant. And you will see again, look at this tissue, is so thin and some areas thick. So look at this, look how thin this capsular tissue is, right? If I were to just remove this, the silicone has, if you ask me, leach into the periphery. We have seen silicone go into the lymph nodes on the exam sometimes, but the tissue behind has to go as much as the tissue on the capsule. Look how thin this is, but that fatty tissue behind has to go as well. And that is, you know, in my practice, I don't want to leave that behind. So I'm going to go ahead and remove. And again, this is again important to return the implants so the patients know what was inside. Again, I removed and contoured the chest, and as I go in, you will see these are fairly new 2019 set of implants, silicone and not saline, and that's the purpose of this YouTube and Facebook Live. As I go in, silicone implant, and as I go in, there's some fluid behind it. My new glove, you can see that leaching of the silicone 220 again as well, silicone implant. And then look again, if you will see my blue glove, some areas so thin, and it has that crunchiness that you hear, and some areas look so thin again, so thin of a capsule. You can see it's almost transparent, but that fatty tissue behind is the culprit as well. So overall, I'm very happy. So you never know what you're going to find on the inside. So this is my third consecutive day. On Tuesday, I did take care of a patient who stated she had saline implants and turned out to be silicone. Wednesday, same situation. Thursday, same situation. The patient was firm that she had what were saline implants, and what I removed was silicone. And it does happen, but this is where you know, the implants need to be returned so the patients understand what was inside. And the silicone implant certainly was removed, will be returned to the patient. The capsule will be sent to pathology, rule out the BIA, LCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. And most importantly, we'll see how the patient does post-op minus these toxins. This is Dr. Khan, Executive Plastic Surgery.